Uh, and we created something called the clinical demonstration unit with nurses and psychiatrists, and we had various graduate students, and we wanted to look at non-pharmacological interventions instead of drugging them up all the time, so to
Right.
speak, to deal with these BPSDs. And we tried things like there was light therapy, which seemed to help some. In Canada, we don't have a lot of sunlight. We do now because it's still summer, fall, but in the winter they're often covered up. So we suffer from something called seasonal affective disorder, which is SAD,
Sure.
which is caused by low levels of vitamin D.
Mm-hmm.
And when you give their specialized light, it can increase vitamin D and help with depression and so forth. We've tried reminiscent therapy, where you look at old photos or movies or something they may have to stimulate their brain and get them back into that talking. And of course, we did music therapy. And music therapy was, we took these baseline measures and we created these customized playlist for patients
Yes.
based on their own favorite songs by family members and loved ones.
Yep.
And it consisted of 20 songs. Pick 20 favorite, and people liked could be gospel, it could be jazz,
Sure.
it could be rock and roll,
But it had to be
classical,
personal
whatever
to them.
they preferred.
Mm-hmm.
It was personalized. And we had to deliver them. We couldn't, unfortunately, deliver the music using headphones like you and I are wearing right now, because sometimes patients become very agitated when you put something on them, and they can become aggressive. Even if you put a name tag, you'll see a patient name tag, they'll try to bite it off. So we got around that by using parabolic speakers. So parabolic speakers are unidirectional speakers. So it would just be focused here. And if someone was sitting beside me, they wouldn't hear the music.
Right.
It costs about $80 Canadian.
Yeah.
Very low cost.
Sure. It's kind of
So
thing
we
they
took
would
these
use like at
baseline measures.
vendor booths, like if you were at a like a trade show.
Yeah,
where you
or at
go-
crosswalks, for
Yeah.
example. If you hear that beeping at a crosswalk for people who are visually impaired,
Okay.
if you go left or right of it, you
Yeah.
won't hear it. But if you're in that crosswalk, you will hear that beeping noise. It's safe to cross.
Makes sense.
Same idea, same type of technology.
Yeah.
And we took these baseline measures, and we had a colleague, Dr. Terry Wu, who was from business and IT. And one of his graduate students was also looking at cost benefit analysis and something called SWOT analysis: strengths, weaknesses, opportunities, threats. And we wanted to look at how often nurses, for example, gave medications to deal with if they were having an episode, an outbreak. These are all costs involved for the hospital and for the care of the patient. So we took these baseline measures, how often it occurred, and then we would administer this music intervention 3 times a week for half an hour. We would monitor how often they were having outbursts during the intervention and also post-intervention.
Absolutely.
The long and the short of it is, we did publish this in a peer-reviewed journal, scientific journal, but the long and the short of it is, music is medicine.
And completely
it really calmed them down.
Yes.
BPSDs. And we're only now starting to look at the benefits of music, or re-examine music and sound and frequencies and how it can be used for various healing purposes.